Welcome back to the program. Let's go to our panel now. We've got Melbourne City Councillor Nicholas Rees and Federal MP Dr Katie Allen. Thank you so much for your time, both of you. Katie Allen, first to you. What's your assessment of where we're at after those numbers today? 484 new cases in the last 24 hours.
Thank you, Kieran. Look, I have to say, of course, we're very concerned by these numbers, and it's a very serious situation, and we absolutely are in containment mode here in Melbourne and Victoria. But it is worth mentioning that we're not on the Italy curve, which in late March and early April was concerning the world about how fast cases were rising. So the Italy curve means that you're doubling cases every 3 days. And in Melbourne at the moment, we're at a certain caseload, but we're not doubling every 3 days. It's taking longer. So it's very critical, it's very serious, but we're not on the Italy curve, and we've got a lot of factors that are in place, that we're moving quickly with contact tracing and testing, and the public is coming with us with regards to the response. So it's a very serious situation. We need to take this seriously, but we need to stay calm.
Nick Rees, and I guess, yeah, indeed, Katie Allen says stay calm and take it seriously, but also, I guess, hope and pray that those numbers start to level out and then come down pretty soon.
Yeah, absolutely. I mean, look, as Katie said, we do have a record number of 6,739 active cases now in Victoria, and we had a record 484 new cases identified overnight. I mean, to put that in perspective, that's the highest number recorded for Australia on any day since this virus first took hold back in late January. In fact, the highest day we had previously was 457 cases, Kieran, back in March. And of course, back in March, Victoria only accounted for 111 of those cases. Today we're in a situation we're at 484. So, look, they're not a great set of numbers, but I don't think there's a case for panic or anything like that. As Katie said, and as Brett Sutton, the Chief Medical Officer in Victoria, said today, the reproduction rate, or the R number, he believes has actually fallen slightly over the last day or so, from about 1.5 to about 1.3. So we're not on the Italy curve, but we are certainly not in a good place either.
No, that's right, a fair assessment. But I guess the thing that worried me as someone watching that as just an observer, obviously not a health expert, but you are, Katie Allen, the fact that a number of people who just simply weren't listening or didn't receive the information. I mean, in some communities, obviously, if people are busy and trying to pay the bills and feed their kids and so on, maybe they just haven't heard the message. But very few people were isolating, awaiting their test, less than half.
Look, I think there's three aspects to the public health response. The first one is Australia's good quarantining services, and we know we've had a bit of a letdown here in Victoria, but that's been, a very important public health response to quarantine people from hotspots, international travellers, and until this Victorian crisis, we haven't had significant community transmission, which means there hasn't been widespread cases that are unknown and in the general community. And that's why this particular outbreak is so incredibly concerning and something we need to get control of. In fact, you could almost argue this is the first wave. This is Australia's first wave happening right here, because before that, we weren't having large amounts of community transmission. It was less than 10%. It's akin to having, a parapet where we've got this good defence force around the nation with regards to quarantining. It's now got a grass fire, a significant grass fire here in Melbourne. So in order to put the grass fire out, you need very serious, military precision contact tracing and tracking. And then you need people who are to self-isolate at that point to do what they're being told to do. So there are some concerns about the on-the-ground amount of expert personnel going in there and assisting with people knowing what they should do when they self-isolated and then actually following those recommendations. And then the third level of public health or, public health support is actually the public health response.
Yeah, and Nick, were you surprised by the hole in that one of those elements, and that is the fact that a lot of people weren't listening or weren't receiving the information as the authorities would hope in terms of that isolating?
Yeah, the Premier Daniel Andrews said he was very unhappy today at data he'd been provided about aspects of the public response in Victoria. So according to the DHHS data, 9 out of 10 people were not self-isolating when they should have, and 3 out of 10 people were not self-isolating after they'd had the test and were required to do so. And that's at the period when you're at your most infectious. So there does need to, and there's obviously been mistakes made in Victoria. What's happened with the quarantining has been well documented, and there's an inquiry there, and there will be a day of reckoning around that as well, of course. But the other issue that, as Katie has flagged, is making sure we get the public behaviour change that is needed to get on top of this. Now, I think generally things have been very good in terms of wearing masks and so on. We're seeing rapid take up there, but the fact that people are not self-isolating when being required to do so is very worrying. And as the Premier said, he's very unhappy.
Katie Allen, is the next step, if these numbers, you said, rightly, we're not on the Italy curve, not on that trajectory, which is some hope, but if they don't start to level out and to fall, if they continue to increase, is just a tougher lockdown, is that simply the next option?
Yeah, look, I think the most important thing to remember is that this is a public health response, and we need to have the community with us on this journey. And what I think has been very important about this mask step is that it's a very visible step that shows everyone in the general public how important this is. So if you go out in the streets now, you'll see people in Melbourne already preparing, masking up this evening when it becomes mandatory. And it's very easy to work out who's following guidelines and who isn't. So it is a step that Melburnians probably wish they didn't have to make, but I think that by making it mandatory, we'll get the whole community coming along with us on the journey. And to say that people haven't been aware about what's going on, you'd have to be pretty hard-pressed not to know something's going on. Even with people with English as a second language, they can't go to the shops they might have been able to go to. They can't go to the cinemas. They certainly can't go to their temple or to their mosque or to their church. And certainly their family members who speak English will be able to tell them something's going on. So it's not just about what messages are getting out there. It's about how much social licence we have as governments to engage with our community. And I think it's very important that we have consistent messaging, mandatory masks from tonight, go home, get a mask. Any sort of mask is fine, but of course the best sorts of masks are 3-layered fabric masks that are reusable, and the reason for that is that then you can wash them, which keeps costs down and obviously helps with waste as well. Disposable masks obviously are very good as well, and the N95 masks are the best. But what we want most importantly is for people to remember physical distancing is number one, the measure that should be taken, good hand hygiene, and then we want these masks as an extra level of safety and security so that we can contain this highly infectious COVID as quickly as we can so that we can then get back to work again.
Nick Rees, just finally to you in terms of the next step. Obviously, the great fear in an economic sense is that a further lockdown, something of the magnitude that the Ardern government had to implement, that sort of stage 4 lockdown might be forthcoming.
Yeah, this is the big debate, isn't it, at the moment, whether we continue with the policy of suppression or move to a policy of eradicate, which is what was done in New Zealand and in a similar format in China, it should be said. As a city councillor, I talk to a lot of businesses in Melbourne, and I can tell you, Kieran, that they are very strongly opposed to moving to an eradication policy. They point to the fact that in New Zealand, where they went for eradicate, they really did put a huge handbrake on the economy. Their economy contracted by over 9%. You can compare that to Australia. To date, we've had a contraction of about 4.5%. Of course, weighing against that, if you look at Auckland or New Zealand now, shops are open again, parties are happening again. Because I'm a nerd when it comes to these things, I noticed yesterday that traffic volumes in Auckland are now up above where they were prior to COVID-19. Equally, if you look in China, like some of the big cities like Shanghai, Beijing, Guangzhou, and you look at their mass transit systems, you see that patronage numbers are now up around 80-90%. So they went for a really hard lockdown, but they're now almost entirely back in terms of economic activity. So this is the real balancing act. I think the Premier today was asked about this, and he said, look, at the moment the settings are going to stay as they are. And it is correct that we need to take some time to see what impact these new measures have. So we've gone back to stage 3A. People are now required to wear masks. I think the wearing of masks, not only is it medically proven to work, but I think it has an important impact on the public mindset as well, because everybody sees each other in the mask, and it's a reminder about the importance of social distancing and good hygiene. So at the moment, it's still a policy of suppress here in Victoria, but I think that variation of suppression is getting harder and harder, Kieran.
Nick Rees, appreciate it, thank you. And also Dr Katie Allen, Federal Liberal MP, member for Higgins, thank you. Let's go live now to the Deputy Chief Medical Officer